Hey people, Katie Kleber here, and I just wanted to do a quick video on some tips, hints on how to deal with patients that are really rude. So I have had some situations as a nurse where for whatever reason the patient is like incredibly mean to me. Wasn't really prepared to deal with those situations, and I had quite a few that left me feeling really low and sad, and like you just don't like being talked to like that. And I just want to remind people that, hey, just because you're a nurse doesn't mean people get to talk to you like crap. I mean, I know patient satisfaction is important, but it's not so important where you're allowed to get abused because of that. So, in saying that, you have to be kind of armed in those situations with how to respond right away, because you just have to stop that behavior, because you still have to take care of them even if they're really mean to you. So I've had situations where the patient's confused and mean and agitated and rude, or they're just a really mean person. And this is what I do in those situations. I give people just a little bit of leeway, tiny bit. And then if they're being pretty rude and demanding and demeaning to me, this is what I say. That's not appropriate. You're not going to talk to me like that. I am here to take care of you, and I need to be respected, and I'm going to treat you with respect. I expect the same back. Boom. Let that sink in for a second, see how they respond. Usually that disarms them, and they're like, oh, I'm sorry. Because honestly, a lot of times, if someone is with it, they're talking in a really mean way or dealing with whatever's going on, and taking it out on you. They're lashing out to the person caring for them because you're the person that's there. You're also not a loved one, and you're gonna probably be gone tomorrow, so it's real easy to treat you like crap. But you call them out, and half the time they realize, like, oh, I'm sorry. I really shouldn't have been doing that. And when you say something like that, it communicates to them, hey, I'm gonna take really good care of you, but I need to be respected. So that's half of it. Half of it is saying that and being empowered, and to know that that is appropriate for you to say that. It is appropriate for you to command respect from somebody treating you crap in a crappy way. But the other half is you got to treat them the rest of the shift. You got to still take really good care of them. You can't shun them. You can't be demeaning or dismissive back to them. You command respect, and then you treat them with respect the rest of the day. That's what you got to do. And then there's also another side of it. I've only had a couple situations, and half the time it's when they're confused. But when saying something like that doesn't work, and they respond in a hostile way back, that's when I call security. Boom, I lean out the door. I need someone to call security for this room immediately. Usually them hearing that is enough to be like, oh, it just got real. Like, it's about to go down kind of thing. Like, it's real. Like, treating me with respect and cursing at me, not going to deal with it. I'm going to have someone in a uniform come in this room and explain to you the way that you're going to act here, because this is not happening. I am not going to be abused emotionally or physically, and I'm setting a standard. I'm setting a line. You're not going to talk to me like that. Boom. A uniform's going to come up, explain this to you, and I'm going to stand right next to him or her, and we're going to talk about how this is going to go today, because I'm not going to get abused in this shift, and that's just the way it is. And you know what? That's life. You don't get to abuse somebody just because you're a patient. Like, you don't get some privilege where that's like allowed all of a sudden. So that is my spiel. If they're confused, that's another thing. Sometimes it is helpful to get a security guard up there, or security officer up there, to explain things to them when they're confused, because even through their delusion, they can see a security guard, and that may provide some like this force of power of like, hey, this is how this is going to go, the situation. And that can sometimes make them calm and provide this structure that they need. So if they're confused, I usually will respond and just provide a consistently strong presence to these people, because they need that. If they're mean and confused and I can't get them to understand what's going on, every time I go in there, I'm going to be strong. I'm going to be confident in what I'm saying this is how this is going to go in this interaction, and that kind of stuff. Strong, not mean, firm, respectful, and strong every time you go in there. You don't go in there with like a meek attitude, because then they can kind of pounce on that. You go in there strong and confident in what you're doing, what you're saying, what you need from them, kind of joke with them and that kind of stuff, but in a very, I have a strong presence kind of way. So I hope that helps you the next time that you're dealing with these kind of situations. And for those of you that aren't nurses and think, is this really necessary? Absolutely. I have been treated very disrespectfully. I have had patients say very sexually and explicit things to me. I have had them be very demeaning, demanding, and disrespectful. And as a nurse, you got to be armed with the way you want to deal with these situations. So I hope this helps those of you that are in these situations, and I hope that helps those of you that aren't usually in these situations understand what we kind of deal with. So that is what I got for you. I hope you guys have a great day. Thanks for watching my video.